Hello, I'm Dr. Greg Winteregg. I'm a dentist and a partner at MGE. And for the tip of the week this week, it's the first of a two-part series on why aren't you getting enough new patients. Now, most doctors that I talk to always say that they need more new patients, but what I've found in my own practice in 22 years here at MGE is that each dentist in the practice, if it's multiple doctors, needs at least 25 to 30 new patients a month. Now, some of you watching may only be getting 5 or 10, and you're doing well and you're still profitable. What that tells me is you have a very successful and steady hygiene department, which is a subject entirely different for another day and another series. But I want to talk about why you're not getting enough new patients. The number one reason is there's no one responsible to get new patients. It's pretty much, in most practices, a job that is done by the office manager or by the doctor, and it's not someone that wakes up in the morning whose job and responsibility is to get more new patients. And the same thing can happen in other aspects of the practice if you're trying to work on recall and reactivation and everybody's working on it when they can, rather than having one person dedicated to do that every day. So the first thing that is generally wrong is you need one person whose statistic it is and who's accountable to get new patients every month. They are helping with direct mail, the website, pay-per-click, monitoring it, etc. So that has to be in, first of all, you have to have one person who you can monitor their statistic every month and say, we need to work on this and that. Now, the second thing, the reason why you're not getting enough new patients is ineffective marketing. Now, it is true that any marketing is better than no marketing. That is true. But now, many doctors don't even know if what they're doing is effective or not because they don't even look at the numbers. So what has to happen is you have to have a piece of graph paper, and you're going to start a marketing campaign, graph out, plot the dots on the piece of paper for the previous 12 months. Then start your campaign, and every month put another dot on the paper. So you can spend $5,000 or $10,000 on a new website. You can be paying $5 on pay-per-click, and the number isn't going up, then it's ineffective. So we aren't going to joke about this or con ourselves that we're doing something if what we are doing is not working. So the second reason you're not getting enough new patients is ineffective marketing. Now, what I've talked about today is handled on the MGE New Patient Workshop. We do one a month around the country. We do them in California, we do them in New York, and we do them in our main office in St. Petersburg, Florida. We have a special that we're running, and all you need to do is go to the URL, newpatients.net, and you can find the special that we're running right now. I hope to see you there, and that's my tip of the week.